Hi, I'm Jack Cush, Executive Editor of RoomNow.com. It's ACR 2017. I'm here in San Diego with all my friends. I just got back from a nice, this is what, Monday afternoon, 3 o'clock session on gout and hyperuricemia, and a really interesting lecture by Dr. Michael Pillinger from NYU. Michael is sort of a leader in the gout field, and he did a 30 minutes on the impact of asymptomatic hyperuricemia. And it was a nice review, and while he showed fairly impressive data that elevated uric acid levels really is not a very good thing. In children, it leads to hypertension, and when you use urate lowering therapy, hypertension goes away. When they gave those kids, same kids who had hypertension and elevated uric acids, placebo, they didn't go away. But when the same kind of studies are done in adults, it's not there. He showed other really good data about levels of uric acid in populations, and the highest quartiles actually having higher risks of cardiovascular disease and poor cardiovascular outcomes. But again, there's an inconsistency to that. And then again, there are a number of different lines of evidence to show the hazards imposed by hyperuricemia, yet the research does not yet show and prove that this is an independent risk factor for either hypertension or renal disease that in and of itself merits individual specific therapy. So such studies are flawed by the fact that the prospective ones have too little data. The retrospective ones are flawed in design. The studies that are most convincing are done in kids but don't hold up in adults. So the bottom line is that there is not yet a full and clear message about when asymptomatic hyperuricemia should be treated. Michael sort of concluded by it should be treated when you think that the benefits would outweigh the potential hazards of giving such therapy. I commented that it used to be that I would only treat asymptomatic hyperuricemia at 14, and then it was maybe 12 or 11, and mainly to reduce the risk of stones and nephrolithiasis and other chronic kidney disease. More recently, I view it almost as a metabolic syndrome cofactor, and so I am treating asymptomatic hyperuricemia, especially in patients who I think may be at risk, and especially in patients who I think can safely take urate lowering therapy. So that's the takeaway message from that nice session, again, run by Michael Pillinger. You could probably look at it at ACR Select online. Tune into Room Now for more good news and videos.